What if I told you that a state spent $20 million to help people keep their health care, but it only ended up covering 173 people? That's not a typo. It's the reality in Washington state, and it's raising some serious questions about how we handle immigration policy, healthcare access, and the human cost of political decisions. Let me break this down for you. So, here's the situation. Washington lawmakers thought they were securing long-term care for nearly 1,200 immigrants by allocating this $20 million. But now, after federal guidance changed, they're realizing it'll barely cover 200 people. And that's not just a numbers game. It's a crisis in the making. Let me explain why this feels so wrong on so many levels. Personally, I think the biggest takeaway here is how easily political decisions can backfire when we don't fully understand the ripple effects. The state assumed this money would scale up over time, but federal rules shifted suddenly, and now they're stuck with a funding gap that's going to hurt real people. What makes this really interesting is the irony. The same system that's supposed to protect vulnerable populations is now leaving them in the lurch. You see, these are people who've built lives here, paid taxes, contributed to their communities, and now they're being pushed into a situation where they can't afford basic care. In my opinion, this isn't just a budget problem, it's a moral failing. Let's talk about the human side of this. Imagine you're an immigrant with a disability, relying on Medicaid to pay for home care. Suddenly, your caregiver is told they can't work anymore because the funding got cut. What happens then? Do you watch your loved one suffer in silence? Do you take on the burden yourself, risking your own job and stability? This isn't hypothetical, it's happening right now. A detail I find fascinating is how the federal government's decision to cut Medicaid for non-citizens is creating a domino effect. People are losing coverage, caregivers are losing income, and the cost isn't just financial. It's emotional, physical, and societal. What this really suggests is that our healthcare system is built on assumptions that don't account for the complexity of human need. And here's the kicker. The state is scrambling to find solutions, but they're up against a wall. They've tried everything from reclassifying people's immigration statuses to asking agencies to stretch dollars, but the deadline is looming. Representative Nicole Macri calls this unprecedented, and honestly, I agree. It's not just about numbers, it's about priorities. If we're willing to spend $20 million on this, why not spend the extra $80 million to cover everyone? What many people don't realize is that this isn't just about immigrants. It's about how we value care work in our society. If we can't afford to pay for home care for a few hundred people, what does that say about our commitment to elderly and disabled citizens in general? This whole situation makes me think about the bigger picture. How often do we let policy changes create chaos for people who are already marginalized? The federal law that triggered this wasn't just a bureaucratic tweak. It was a deliberate choice to exclude a group from essential services. And now, the fallout is cascading through hospitals, emergency rooms, and families. If you take a step back and think about it, this is a warning. When we cut funding for care, we don't just hurt individuals. We destabilize entire systems. The cost will show up in ER visits, in 911 calls, in the rising burden on unpaid family caregivers. It's a perfect example of how short-term savings can lead to long-term disasters. So where do we go from here? The unions are pushing for more money, but Washington's budget is already tight. The governor's office is being asked to be creative, but creativity doesn't fix a $80 million gap overnight. What this really highlights is a deeper question. Can we afford to treat care as an afterthought? Or are we finally ready to recognize that healthcare isn't a luxury? It's a foundation for everything else? I'll leave you with this. If we can spend billions on defense or infrastructure, why not invest in the people who keep our society functioning every single day? The answer to that might just determine whether we're building a system that works for everyone, or one that leaves people like these 173 behind.